Okay, so we will check her wrist. And we do the same here. We start gently. And here I always use the thumb. When you practice this, you need to practice a lot to increase the sense in the fingertips. I go in between like this, and I'm looking for every single tendon here.
It's all about feeling slowly and feeling the changes. I mean, if you can explain what you feel.
Yeah.
Oh, yeah, maybe you feel pain.
What do you feel?
This is pain.
A little bit pain.
Slight pain.
Yeah. No, I'm looking here the same as I did on his knee for any changes. First of all, I'm checking all the tendons that they are whole and have strength and resistance. So they're not a spongy or whatever. I can already notice her wrist is quite weak. So now I'm looking for if it's any damage because she have provoking pain, but you also have aching all the time.
It started yesterday, so it's not.
Okay, turn around. So before I go deeper, I just check everything gently like this. Okay, here we have something nice. How does this feel? So the whole ligament here is very weak. So it's probably been for a while because I can come down through the ligament in the joint way, way too easy. Maybe you drive like this very long time, huh?
The bad habit.
Yeah. Okay. Now I will, first of all, I will check these. Compress. So they probably outside here. Now, okay. Now I go deeper, and here is crunching. How's this? This is nice, huh? Yeah. So here she have a little bit of change, and she actually part of the attachment here is actually released from the bone. If I just do like this, you can see it's way, way too deep. Is it pain?
Yeah.
It's nice, huh? Pain is good. That means you're alive. Take the hand up. Also, now her sweating is increasing massively in the hand. It means we are on the right way to find the source here. I separate the wrist like this, go in again, and there it is. It's very nice. Now you will never forget my name. You need to promise, otherwise I don't let go.
What is the pain out of 10? 10.
Yeah.
10.
Yeah.
Okay.
But
So-
actually, I have tension here. I think.
Yeah,
there is
but this is
something
a
maybe
compensation for this here. You have some alcohol gel. I need to wash it off because you started sweating here like crazy. Okay, here we are. Okay, do we need to check it again? You remember where it was? Ah, good.
The pain is still.
I will use this very low one on you too. Now I take it. Now depend on the state. Now I'm using low frequency. I could use much stronger, but now depend on, because the tissue into the skeletal attachment is not so deep. So I don't need to use so strong. So the more superficial, the lower you use. Also, when you do methodology for the patient, always start low and build it up session per session. Yeah, because if you have, in this case, I will now shooting through like this. If you remove 100% of the pain for a patient from an acute injury, they will go out and do stupid things. So you need to be careful. Yeah. Ah, good question. It depends. You always put the positive as close to the main problem as possible. Always, yeah. And then the negative, if you want to shoot through the joint in this case, because you don't know, because to get exactly. And because when you have this kind of injury, you probably have a lot of compensation injuries in the joint. And you want to remove all of these obstacles. It can also be because of muscle weakness here that this happened. But now I just chose to treat this very simply. Yeah, different from different. You always follow the muscle, normally. Shoulders also, if you want to shoot through from this side, or follow like this, all depends on what kind of problem you have. So you need to know your anatomy. You need to know the movement. Yeah. No. Always muscle and tendon, and the injury is how it's developed. This is why it's so important you learn to examine it properly so you can find out where the injury is. Especially shoulder is the most complex joint we have. This pain can come from everything on left side, from spleen, kidney, neck, cervical spine, scapula, or anything. You cannot trust referred pain. And then you decide. And the good thing is you apply the device and you wait. If the patient is good, you know you did right. If it's no effect, you did wrong. And then you need to reassess. We have many therapists and doctors that listen to the, oh, doctor, I have pain in the shoulder. They apply the disc and nothing happens. Because that was not the problem. Never trust a doctor. Do you have an ADL? Do you have an ADL ACA? I don't have it. Okay, I can test it now. Okay. Now I push 200 times more. You didn't like me before, huh?
You're putting the same pressure? Oh, no.
This is the same pressure.
Less, maybe 5 or 4.
Okay, now it's 200% more.
It's not like before, but maybe it's 7.
Just wait. I will
But
also.
The pain here decreased.
Wow. Of course, because that was the problem. I will also give you blood flow and nitric oxide. We always need to optimize the circulation.
So, and every time we do any rhythm, you just need to put the blood circulation.
I do. Not everybody. It's not. If you want to do a high quality job, you need to think of this, of course, because the result will be faster, better, and the end result will be even better. The same. AP2, yeah. But you get. What are they doing? I'm waiting for the antioxidant. Yeah. So then we have the antioxidant carnosine. Carnosine antioxidant is 2 different amino acids that is the body's natural anabolic steroid. This is the one that heals everything in our body. And also the reason you get IBS is lack of carnosine. So I helped a lot of IBS patients with this in a very simple way. It's an advanced way. And we're waiting for
Sound effect.
it must be the Polish guy.
It's normal to feel.
Sorry?
It's normal to feel something inside.
Of course.
Okay, so it's working. So I'm feeling something is rooming like this.
Yes, of course. No, they are very powerful. They're very strong. I'm just waiting for another antioxidant called glutathione that is removing the free radical that's creating the problem. Then we will be sadistic. If he finds it. Antioxidant carnosine. Carnosine, yeah. Now it's 500% pressure.
It's not paining from the pain before, it's paining because it's pushing on the
Pressure, yeah.
Yeah.
Then I'm happy. Then it's 100% better. And this is
How long will you keep this stuff?
3 days.
Is it?
And this is glutathione.
You need to keep this for 3 days?
Yeah, sorry.
3M. 3M, the strongest adhesive from 3M.
So the patient can shower, can.
Yeah, swimming pool, anything. Yeah.
Will not.
The most important, if they have all this nice outfit and they are sweaty, to clean off the body a little bit. Where you apply the device, to use anything, yeah, pre-tape spray or whatever, also on sweaty bodies, because then they stick longer.
On athletes. or-
Athletes, pre-tape spray, or put kinesio tape over. If you see football players, big names with tape over weird spots in our doctors, then you know what it is. Okay, you ready? Sure, it was nice to know you.
Very good.
As I told you, it's not paining because it's pain. It's
Only the
pain with
bone.
pressure.
Okay, see how it feels?
Well, when you feel it's true.
I hope this guy has pain. You have pain? I think
It-
you have pain.
It will be a pleasure to examine you very deep. Just you can tape around it so you don't fall.